Hello friends, welcome to my YouTube channel MedPlus. Today we are going to discuss JIPMER Nursing Officer 2012 old question paper with answers. This video will be very helpful for upcoming JIPMER exam 2022. First question, an emphysema patient can receive oxygen flow rate of 1 liter per minute, B 2 liter per minute, C 6 liter per minute, D 10 liter per minute. Answer B 2 liter per minute. An emphysema patient can receive oxygen flow rate of 2 liter per minute. Answer option B 2 liter. Second question, which is most important or most distinctive sign of failed chest? That is most distinctive sign of failed chest. A. Cyanosis, B. Hypotension, C. Paradoxical chest movement, D. Dyspnea especially on exhalation. Answer paradoxical chest movement. We'll go for third question. Bunch of grapes appearance in chest X-ray seen in which condition? Option A. Pneumoconiosis, B. Histoplasmosis, C. Bronchiectasis, D. Interstitial lung disease. Answer is C. Bronchiectasis. Bunch of grape appearance in chest X-ray seen in C. Bronchiectasis. Fourth one, first heart sound indicate the onset of. First heart sound indicate the onset of. Options A. Atrial systole, B. Atrial diastole, C. Ventricular systole, D. Ventricular diastole. Answer is ventricular systole. Ventricular systole, first heart sound indicates systole. Next one, fifth question. Disulfiram is a drug used in the treatment of. Answer options A. Hallucination, B. Mania, C. Catatonia, D. Alcoholism. Answer D. Alcohol. Sixth question. What is the maximum volume that can be given IM? What is the maximum volume that can be given in IM? Options A 0.5 ml, option B 1 ml, option C 2 ml, option D 6 ml. Answer is option D 6 ml. Rifampicin is used for prophylaxis of option A. Gonorrhea, B. Malaria, C. Leprosy, D. All of the above. Answer C. Leprosy. Rifampicin is used for prophylaxis of. Answer option C. Leprosy. The diagnostic study to assess left ventricular dysfunction. The diagnostic study to assess left ventricular dysfunction. Option A. Angiogram, B. Catheterization, C. ECG, and D. Echocardiography. Answer D. Echocardiography. Ninth one, Verapamil is. So the questionnaire is intending what is the action of Verapamil. So let's see the options. Option A, beta adrenergic blocker, B, H2 receptor antagonist, C, cardiac glycoside, and D, calcium channel blocker. So what is the action of Verapamil? Answer, calcium channel blocker. The drugs which is ending in A, that will be comes in the category of calcium channel blocker. 10th one, acid-base imbalance that develop in acute renal failure. So what is the acid-base imbalance that develops in acute renal failure? Options A, metabolic acidosis, B, respiratory acidosis, C, respiratory alkalosis, and D, metabolic alkalosis. So the answer is metabolic alkalosis. So acid-base imbalance develops in acute renal failure is metabolic alkalosis. So there will be metabolic dearrangement and there will be fluid retention. So it will be metabolic alkalosis. Fluid increase in body means it will not cause acidosis, always it cause alkalosis. So acid base imbalance in acute renal failure is metabolic alkalosis. So the 11th one, clay colored stool is suggestive of which condition? Clay colored stool is suggestive of which condition? Options: option A, amoebic dysentery, B, typhoid, C, ulcerative colitis, and D, obstructive jaundice. So answer D, obstructive jaundice. 12th one, surgery done for myasthenia gravis is. So what is the surgery done for myasthenia gravis? Option A, pallidotomy. Option B, hypophysectomy. Option C, sympathectomy. Option D, thymectomy. So answer D, that is thymectomy. We are removing the thymus gland in order to decrease, or in order to prevent, or in order to decrease the signs and symptoms of myasthenia gravis. So myasthenia gravis means thymectomy. The surgical management for myasthenia gravis is thymectomy. Next one, 13th one. What is the effect of cyclosporine in a patient undergo renal transplantation? So why we are giving cyclosporine in a patient who is going for a renal transplantation? So answer A, immunosuppressant, B, anti-inflammatory, C, antibacterial, D, diuretic. So why we are giving cyclosporine in a renal transplant patient? Answer A, immunosuppressant. Why means in order to avoid rejection reaction, we need to suppress our immune system by giving immunosuppressants. That is why we are giving cyclosporine. Its action is immunosuppressant before going, or we will continue that drug in order to eliminate transplant reaction, or the immune reaction, or to suppress our immune system, we are giving cyclosporine. 14th one, normal glomerular filtration rate is. Option A, 100 ml per minute. Option B, 120 ml per minute. Option C, 120 liter per minute. And D, 2 liter per minute. Answer is 100 ml per minute. Then 15th one, carpal tunnel syndrome is caused by. So what is the reason for carpal tunnel syndrome? Option A, pressure on cephalic nerve. B, damage to lower motor neuron. C, pressure on median nerve. D, injury to the wrist. Answer, the correct answer is answer D, injury to wrist joint. 16th one is a simple question. Speech center is. Answer A, Broca's area. B, premotor area. C, frontal area. D, post-central area. The answer is A, Broca's area. So speech center is our Broca's area. So the 18th one, amount of current used in giving ECT is. Answer A, 200 to 250 volt, B, 150 to 200 volt, C, 50 to 100 volt, D, 70 to 130 volt. So answer is 70 to 130. So 19th question, surgical fusion of a joint known as. Surgical fusion of a joint, that is we are fusing two joints by surgical intervention. What is the technique called? So answer is A, arthrodesis, B, arthroplasty, C, arthrotomy, and D, nailing. So the answer is arthrodesis. Arthrodesis means we are fusing two joints by a surgical. 20th question, the maximum height at which the enema should be held while giving it is. So the maximum height at which the enema should be held while giving it is. So answer is A, 66 cm, B, 45 cm, C, 37 cm, D, 30 cm. Answer is B. 45 centimeter. 21st question. The pituitary hormone that stimulates secretion of milk is option A. Prolactin, B. Oxytocin, C. Estrogen, D. Progesterone. Answer is prolactin. So the pituitary hormone that stimulates milk secretion, that is prolactin. 22nd question. The most common site of occurring peptic ulcer. So in stomach. So which part of the stomach peptic ulcer is common? So option A pyloric portion, option B cardiac portion, option C esophageal junction, option D body of stomach. So which part peptic ulcer is more common? It is more common in pyloric portion. So peptic ulcer means P. Peptic ulcer starting with P, and it is most common in pyloric portion. Pyloric portion. Parenteral preparation of potassium should be administered slowly to prevent. So why we are administering IV potassium in a slow manner? Why? What is the reason? So A. Acidosis, B. Cardiac arrest, C. Respiratory arrest, D. Overload. Answer is B. Cardiac arrest. So potassium means first side effects. If potassium we give potassium in a fast manner through an IV route. First thing that should come to our mind is cardiac arrest. Potassium like the increase means, or we are giving an infusion of potassium in a fast manner means the patient can develop cardiac arrest. So the answer is cardiac. Then 24th question, causative agent of mumps is answer A. Bordetella, B. Paramyxovirus, C. Toga virus, D. H. influenza. Answer is paramyxovirus. Mumps causative organism is paramyxovirus. 25th question, dose of acetyl salicylic acid is. So what is the dose of acetyl salicylic acid? A. 10 mg per kg per dose, B. 500 mg per dose, C. 100 mg per kg per dose, D. 50 mg per kg per dose. Answer is B. 500 mg per dose. Thank you for watching my video. Please subscribe, like and share.